especially here in Michigan, as our state is now one of four seeing a big increase in the number of COVID-19 patients between the ages of 20 and 30.
Our chief health editor, Dr. Partha Nandi, joins us now. And Doc, is it because we're starting to get out and about?
Yeah, there are a lot of reasons, Glenda, and some of it has to do with increase in testing, obviously, but a lot has to do with attitude and behavior. Young folks are really not taking this very seriously, not as seriously as older folks critically. Instead of social distancing, here's what they're doing: they're hanging out with friends, and many of them are not wearing masks. They're standing too close, and they're in large gatherings. A great example of this was what happened at a popular bar in East Lansing. The bar attracted a bunch of people. There were long lines, and unfortunately, many didn't follow any protocols. So it's not a surprise that 25 people between the ages of 18 to 23 now tested positive for the coronavirus, and that's a big concern.
So, Dr. Nandi, are you worried about the recent spike in positive cases among young people?
100%, Glenn. I'm super worried. And young people, typically, let's just face it, they typically don't get as sick as older folks. Don't need intensive care unit. They don't need the ventilators, and maybe because they have less underlying conditions. But it's not a guarantee, and I'm worried that their behavior will unfortunately may have serious consequences for them, but also for the older generation, right? They can easily spread the virus sometimes when they're asymptomatic, when they're visiting parents, grandparents, and others that come around in close contact with them. And that to me is very concerning. Young people who are watching and listening, and if you could spread the message to them that they need to be more concerned about others, and they could spread this easily if they get COVID-19. But it's an easy solution, right? Just follow the protocols and we will get back to where we were again.
All right, Dr. Nandi, thank you so much.